Next up, we have Adrian Schauer. I hope I'm pronouncing it correct, Adrian. I probably said this last time too, since you were at TechTO Health 2 years ago. But Adrian is a serial tech entrepreneur and founder and CEO of Alayacare. And I'll let you take it away, Adrian.
All right. Thank you, Maggie. So just to start with what my organization's all about, fundamentally, we're animated by the purpose of enabling the type of care we would want our loved ones to receive at home. And then, you can get into the details of what that means and how multimodal data-driven interventions is kind of the future of this segment. But I want to take a minute to talk about how what we're doing encourages equity, both in what we do and how we do it. And obviously, it's an area that's gotten a lot more spotlight in the recent past. But when I look at what social justice means within our organization and how we go about our days and the type of people we have in the environment we allow to flourish or help flourish, through to what individuals on our team do outside of work, but with the appreciation of their colleagues. And then I think most importantly, from an impact point of view, is if you look at the frontline care workers in our space, it's often an underprivileged, racialized community. And again, it depends a little bit where you're doing business, because we work around the world. But really creating a work environment. So it's not just the patients we're impacting, but giving tools for the caregivers to actually have as good an experience and get as much income stability as possible. So if you look at our observation of what's happened to home care within this pandemic, we absolutely observed what this forecast graph from a group in the States called Home Care 100 showed. So, mid-March, pandemic hits, 10 to 20% drop in the demand or the amount of home care that's delivered. And then quite a quick recovery of that. You see the two segments of what we do. So personal care, which is the non-medical home care, think of your personal support worker, and home health, which is the nursing and therapy services delivered in home. So what this group expects, and we share this view, is that there will be a fundamental shift in care setting away from congregate care settings, the nursing homes and the senior living facilities, towards the home as a preferred care setting. And so when we started Alayacare 6-ish years ago, the first three things on this list were already true. And again, these are very echoes of Zaina's points. Generally speaking, patients or citizens prefer to be at home than in a hospital or a long-term care facility. It's actually better for the health system. And the great hidden resource of the healthcare system, of course, is the family caregiver, the proche aidant. And you leverage that resource much more in a home setting. But what the last couple of months have revealed is that infection control is actually much more easily realized in decentralized settings. Even the best, most prepared long-term care facilities, many have had infection issues. And even when you avoid those, it often comes at a big human cost in terms of social isolation and so on. And the other thing that our industry has proved to ourselves is that there really is a lot of value that can be delivered virtually. So if you roll those forward, what does this mean for the technology toolkit that the tech ecosystem can bring to the space? And again, here I'll speak mostly for Alayacare, but if you look at that patient journey and everything from that initial assessment and the design of the care plan, we've seen how much of that can really be constructively done virtually. And so how much we increase the capacity of the system as a result. And then we've also been working with data science techniques to provide decision support alongside that care plan design and care plan creation. So Major opportunity at the outset of the patient journey in community, then monitoring of patients while they're home. And remote monitoring is not a new thing, but adoption has certainly been lagging. So I think that's an acceleration that will stick. And family caregiver engagement as well, big category there. Then into data insights. So from a public health point of view, the light that has been shone on a lack of real-time data insights into what's going on with the health of the community, I feel has really been highlighted. In fact, I've been very disappointed as a citizen to see how the truth on the ground is reflected in the media and how big that disconnect is, and how public policy and perception and actions of individuals would be different if everyone were making more data-driven decisions. But in our domain, it's mostly about making sure patients are following along care pathways, and that you're able to stratify the risk of your patient and optimize your interventions based on what the data tells you in terms of how the clients are doing. And then, of course, being able to deliver care beyond in-person visits with tools like virtual visits. So even as we bring this more advanced toolkit to an industry which, honestly is several years behind, I would say, much of the consumer economy, what we can't forget is that in general, home care does not have a demand problem. It has a supply problem. And if we look at the frontline care workers and reflect as a society on the level of respect and compensation that your average non-medical home care worker gets, and I would say the same is true in long-term care facilities as well. I think this pandemic has highlighted the fact that we need to treat that societal asset, I think, with a bit more respect than we have to date. But you also have this great irony in our space whereby there's, in the US, there's about 80% turnover of care workers, frontline care workers every year within home care organizations. But the number one reason for that is that I didn't get enough hours, or I didn't get stable hours, or I didn't have income stability. And so you have at the same time a shortage of work, while you have a shortage of labor supply. So technology can really help bridge that gap and stop those perverse types of situations. And then if you take a step back even and look at how health systems are designed, we think there's much better balance that can be struck between the needs of the patient and the needs of provider when you get into home care and community care. So we really see technology having a big role to play. All right.
Thank you so much, Adrian.